Hi, I'm Lai, your Seni for today, and now I'm going to discuss a spinal cord injury. What is a spinal cord injury? Spinal cord injury is a damage to any part of the spinal cord or nerves at the end of the spinal canal, cauda equina, which often causes permanent changes in strength, sensation, and other body functions below. Most common causes of spinal cord injury are the following: motor vehicle accidents, falls, acts of violence, sports and recreation injuries, alcohol, and some diseases. Auto and motorcycle accidents are leading cause of spinal cord injuries. Why? Because a car accident can result in a sudden blow to the spinal cord or the surrounding tissue, including ligaments and vertebrae. And a car accident that causes injuries to the spine can result in paralysis that affects. A spinal cord injury after 65 is most often caused by fall. Why older people are most likely to have fall? Because they have a chronic health condition which can cause dizziness, impairments such as poor vision or muscle weakness, so they have more likely to have a fall. Next to motor vehicle accident and falls, acts of violence are the most common cause of spinal cord injury that result in paralysis. Sports and recreation injuries. Athletic activities such as infact, sports, and diving in shallow water cause about 10% of spinal cord injury. Another common causes of spinal cord injury are the alcohol. Use is a factor in about 1 of every 4 spinal cord injuries. The diseases. Some diseases that can cause spinal cord injuries are cancer, arthritis, people who have osteoporosis, and inflammation of the spinal cord also can cause spinal injuries. Signs and symptoms of spinal cord injuries vary depending upon the location of the injury and if the injury is completed or incomplete. Some of the signs and symptoms are tetraplegia, also known as quadriplegia. This means that your arms, hands, trunks, legs, and pelvic organs are all affected by your spinal cord injury. Paraplegia, this paralysis affects all of the part of the trunk, legs, and pelvic organs. Loss of movement, ataxia. Loss or altered sensation including the ability to feel heat, cold, and touch. Loss of bowel or bladder control, inability to control bowel movement, or fecal incontinence, exaggerated reflex activities or spasm, changes in sexual function, sexual sensitivity and fertility, pain or an intense stinging sensation caused by damage to the nerve fibers into your spinal cord, difficulty breathing, shortness of breath, coughing, or clearing secretion from your lungs. That is the sum of signs and symptoms of spinal cord. While you are having a spinal cord injury, there is a treatment or medical care given to a patient for an illness or injury. One of the treatments are maintaining patent airway. Why we need to maintain a patent airway is to prevent obstruction. because airway is called patent whenever there is an open pathway between a patient's lungs and the outside world. An airway obstruction is a blockage in the airway. It may partially or totally prevent air from getting into your lungs. Another treatment for spinal cord injury are preventing shock, immobilizing your neck to prevent further spinal cord damage, avoiding possible complications such as stool or urine retention, respiratory or cardiovascular difficulty, and formation of deep vein blood clots in the extremities. Medication, rehabilitation, immobilization. Why immobilization is important? Because it's to prevent secondary spinal cord injury during extrication, transport, and evaluation of trauma patient by minimizing movement. So now that is all about spinal cord injury. Have a nice day and thank you.